WRC Safari Rally 2025. Revisha and feel the roar.
Tem nebo arawetab somok kenyitab 2025 betut age nebo kwangwan kasi nekituisoti eng yutobo studio nebo Kass TV tetutiet nebo longetab Kabotik itagat missing kigurenon Caroline Kiplagat au kou en kwegeny ko kitaunen kekushini gong logoiwek cheterter chekamuch kobitu kobun komoswek cheterterchin chebo emoni. Kigurenon Caroline Kiplagat kitaunen Kembauni County nebo Uasin Gishu ole katelelso boisionikab konyoiset eng sipitalitab boror nebo Moi Teaching and Referral Hospital Eldoret. Kosubkei ak nekoistogei eng boisiet nurses chebo sipitali noto komoche kisuldochi magutik kwach kou en kayonjinet nebo CBA nekisirchi ak sipitalit noto nebo MTRH. Kamwa nurses choto kole tomo koibchi komonut rirek kwach kandoinatet nebo sipitali noto ole kaikimit kole mawekchinigei boisiet ako kikochi ichek imanda ngwany. Sirinyo Timothy Kiplimo kotinye logoiwechuto en koindo kong'eten Uasin Gishu.
Kikitil budget nebo MTRH amakingen kele kikiconsulten president ketebe kelechi kakitil budget nebo MTRH anan kikimeto kityo ngunotok sikobit koek sabotaging president nenyonet kele kame sipitalitab referral.
Kaindochi kanyoichoto trustee nebo Kenya National Union of Nurses and Midwives neboishe kora ko kanyoindet en sipitalitab MTRH Beatrice Chepkoech ole kamwa kole kaimutiet netesetai kobun sipitalitab MTRH en inguni kotinyegei ak tiletab rabinik chekicham konyoru sipitalinoto kobun serikalit neo en emoni. Kit nekamwa alak en kanyoik en sipitalinoto kole kikowech kasuldaetab CBA nebo kenyitab 2021-2025 ole kaikimit kole mabendi kowekse boisiet akoi koityi sipitalitab MTRH makutik tugul chebo kayonjinet nekibo tai.
Iingilie hii mambo na isote na itimishe yara yenye inatakikana, irudishe mgao wa budget vile ilikuwa. Na hapa kwa hospitali tunasema ya kwamba yale matakwa ambayo tulielewana kwa ile mkataba wa CBA collective bargaining agreement ya 2021-2025 promotion, tulikubaliana kwamba muuguzi anatakikana apromotiwe after 3 years. Hiyo mambo itafanyika mpaka saa hii. 2 years itafanyika mpaka saa hii. Hakuna kitu imetimizwa. Kwa hiyo makubaliano yenye tuliweka na ikasainiwa mpaka ikaenda kotini ikawa registered. So tunasema hiyo mambo yote inatakikana ifanyike ndio turudi kasini.
Muuguzi ndiye aweze kuhudumia mgonjwa mzuri, lazima yeye pia apate pima ya afya yenye inamtibu mzuri. Kama mtoto yake ako kule Mombasa, lazima apate hospitali mzuri kule Mombasa na atibiwe mzuri. Si ikuwe kwamba unatibiwa peke yake kwa hospitali ya rufaa ya Eldoret.
Alak eng tuguk chemoche kanyoichoto koboto katororet en boisiet anan promotions, kalititetab tuchet nebo kanyoiset nekamwa kole maboisie en sipitalisiek alak kobate MTRH kityo, lipanetab rabinik chenotin ko statutory deductions, itondo neya nebo boisiet koboto usisiet ak kanyalilet nebune kanyoichoto. Kit nekamach president nebo emoni Dr. William Ruto kochutyi asikoker kole kakilitit kaimutichoto.
Kokisome kaminginetab kele president nenyonet kichomina kwa cheke chekikibirun kura nyosi saru sipitali nyo nebo Moi Teaching and Referral Hospital amu ngalek chenyoru komuchi koberberin biik kole chamegei senge lakini machamegei senge. Eng referral kokobut sipitalitab referral amu angot tuguk chekiboisie komamite tukyoto makitinye angot seletep na kikure seletep nebo Nandi nekirate mook mamite angot kokobetwech kele singeuni mook kiuni akeratene. Mat kokon biik siaset ak koberberech kole meche kewirte sipitalit nenyo sipitalit ak ketie sipitalit amakoi kiberbergei kele kebut sipitalit ako kolembechek. Imanda nebo kweli nekimwoe eng taitab Jehova amu inendet president nenyonet kochome Jeiso kemwoe kele kokobut sipitalit nyo ak kakisome kaminginetab kei kele nyo ngololji ministers chebo health, ngololji PSS, ngololji members of parliament, ngololji icheket biik chemite sector nebo health kobit kobwa sikobit kosaru sipitalit nyo tugul. Simutamaname chaibu kele kimite gaa akakobut sipitalit nyo nebo gaa.
Moche kanyoichoto en inguni kandoinatet nebo sipitalitab MTRH koker kole kakushikong magutikwak akoityi kamanutiet nenyolu kotomo kowek ichek boisiet.
Nebo aeng kora kokakisome kele management nebo MTRH ngot ko kyong'ololse man ko kyoit ano ng'alalanitok sikobit ketoretkei tugul kitelel sipitalinyo nebo referral simebut. Eng ng'alekab promotion ko kakisome kora kele mat koberbere management nebo MTRH amu kitinye CBA notok ko kikisirchine. Ngiwe kaboyob ko kakosirchine ng'olyo ak kaotar ng'oliondonotok ko makiwekse kokeny kelen kikamwa ne boyob ko. Kikakiyonchine komie kele implementani icheket CBA notok 100%. Lakini kong'etegei betunotok ko berberech MTRH kole kiyoe kuni kiyoe.
Kong'et eng kanaset nebo Eldoret en county nebo Uasin Gishu, logoiwekab emet chebo Kass TV, kaninyu ko Timothy Kiplimo.
En kasarata ko kakoyomis cabinet secretary nebo tililindo Dr. Deborah Barasa kole manyolu kosich kayuiset agetugul biikab emet kosubkei ak nekitelel emetab Amerika toretet nebo alage eng tetutik choton chebo kanyoiset mising ko kerichek choton chebo ARVs. Kayomis ine kole tesetai serikali kosuldoen tetutik cheterter chetokchini koker kole kabitu kerichek choton ole boisie ichek ak stakeholders cheterter koro kole kanyoru biikab emet kerichek choton kasarta age tugul nemakchinigei. Kenyoru Nelson Tarbei kotinye koindab logoiwechuto kong'ete Nandi.
Kamwa cabinet secretary nebo kanyoiset eng emet Daktari Deborah Mulongo Barasa kole testai serikali koyai ng'alalet ak stakeholders cheterter netokyingei kero kele kanyor kerichek biik chemeng'ishe ak miondab ukimwi eng emet.
And I have instructed Dr. Mulwa kuhakikisha madawa yale yako njiani yafike hapa ndio mtu yoyote asikose madawa. Hivyo ndio tutaweza kupunguza virusi na pia uambukizaji wa ugonjwa wa ukimwi utapungua. Sasa ningetaka tu kuwaelezea kama Wizara ya Afya tunashughulikia hiyo mambo sana. Tumeandika ripoti, tunakutana na development partners, tunaongea na treasury kuhakikisha madawa ya HIV yani ARVs yako karibu na mtu yoyote ambaye anahitaji kuyatumia na mtu asikose madawa.
Kang'alalin eng county nebo Nandi eng sipitalitab Mosoriot eng kasarta nekayate komosta nekinyoe kelek ole kabinit eng kasarta nekakibwat akobo tililindo nebo kutit eng emet.
As we commemorate the World Oral Health Day, we align ourselves with the global theme for 2025, a happy mouth for a happy life. This theme underlies the connection between oral health and overall well-being. It serves as a call of action for individuals, communities, and governments to prioritize preventive dental care and foster awareness about oral hygiene.
Kayamis ine kole testai serikali koborchinkei koro kole kakitoret biikab emet konyor kanyoiset nebo kelek ole wendi nito kotoreti keistogei mionwogik chebo kutit. Kayamis rubeiwotab gavana nebo county nebo Nandi Dr. William Mitei kole borchinkei serikalitab county nebo Nandi kotestai koro kole kakikanapta tililindo eng county nebo Nandi.
Have 154 health facilities run by the county government of Nandi. Out of those, we have high volume facilities, which are 14. And we have also enhanced our HRH, and we are on course to bring back some of the staff who are affected by a recent HR exercise. We have done the first over 120, and we are going to conduct interviews for another set. In total, we want to bring back over 600 healthcare workers who are affected by a recent HR exercise.
Eng komosta nyi komwa MP nebo Chesumei Paul Piok anan Polo kole nyalun biikab emet kotestai kosirkei eng tuget nelel nebo kanyoiset noto nebo SHA ole anganda mitei kaimutik eng tuganoto kowendi kochulaksei eng konekit.
With the small problems ya SHA hapa na pale tuvumilie the ministry, and I also urge you CS and PS to actually speed up the systems so that people would appreciate this facility of SHA. Otherwise, I encourage all of you to register in SHA so that while the system peaks, it peaks while you are registered.
Kong'etegei county nebo Nandi logoiwekab emet chebo Kass, kainenyu ko Nelson Tarbei.
Ngepengune county nebo Kericho ole karutechi nebo kecheret en Kass Media Group Dr. CK Joshua. Familia nebo kabarastaindet nebo Kass Kwanet Dr. Kipkoech Arap Sambu en mengotenyin nemito Ainop Kelesen Matobo, Kericho County. Asikokoito ng'oliot amutyo kosubkei ak sirtoetab osotiondenyi Ambassador Lily Sambu nekiibet sobenyin en wikit nekosirtoi. Kamwa Dr. CK Joshua kole kiigilgei Ambassador Lily ole kinomu boroinwek cheterter ak acher biikab emet mising ko bororietab Kalenjin kocham somanet kou yekicham Mama Lily Sambu asikonyoru borotet. Ngenyorun siri nenyo Robert Siele ak report kong'ete Ainop Keles.
Kong'ololchin ketishoni en oret ne inegen kasarta nekarutechi familia nebo kabarastaindetab Kass Kwanet Dr. Kipkoech Arap Sambu en Ainop Keles Matobo en county nebo Kericho kosubkei ak kabetetab osotiondenyin Ambassador Lily Sambu, komwa nebo ng'echeret en Kass Media Group Dr. CK Joshua nekamiten ak familia nenyinet kole noton ko koibet icheket chito nekorikunat mising.
Kimwoe mutyo en gai ako family nebo Kass FM kimwoe kele pole in behalf of Kass FM tugul koboto kokwek tugul chomi yu amu ngele Arap Sambu kobo Kass FM akine ako tupchenyu kokimwoe kele mutyo my brother for the loss of our in-law, our murtonyo, our sister, our mother. On behalf of my family and whom are here today together with me, except Kigen who is in London, kimwoe mutyo.
Kosubkei ak Dr. CK ko Ambassador Lily Sambu ko king'amotiot nekilany en boisionik cheterter kosubkei ak kakiletabkei nekitinye.
Amune ko a career consummate diplomat nekikoyai kasikab diplomatic service for many years. From a professional as a professional teacher ako diplomatic services ko kikoyai kasisiek en emoni. He contributed to the society, not only to the society but also to the family in general. Pole en bororiet, pole en kokwet, pole en chitugul neingen kai ak tilyonutik cheingen ng'alekab Kass FM tugul imwoe kele imwoe mutyo.
Shin boroinoton Dr. CK kocher biikab emet kocham somanet kosubkei ak kabarunoik chemiach cheibu somanet.
Amu choto ko engineers chebo karon, daktari chebo karon, ambassadors chebo karon ko lazima ke maken sure kele kaba lagok sukul. Sacrifice ni akot ndemeche ialde mbaret ko kosoman lagok. Ko nyoru rabisiek tun yatar somanet konyoru koyoe tuguk cheechen kosindan. Akot mbaret nekoitinye nekocham imwoe ile itinye sait itinye mbaret nemobo isoben kaikai ialde kosoman lakwet. Yai juu chini kila pahali maken sure ile kakisomesan.
Kates nebo ng'echeret en Kass Media Group kole bo kamanut kora kekonyit ak kerib lakwet ne chepto ak keipchi kamanut kanetisiet mising kotinygei ak mung'aret asikeib walet en emoni.
Ako law is not discriminate the girl child and the boy child. Maken sure kele kaba tugul somanet amu dunia nekibendi ra en betusiek chekibendi koui amu technological revolutions chebo ng'alekab AI ak ne kowole dunia. Akot en betusiek cheking'oloni ak biik en betusiek chekisirtoi ko kikimwoe kele en betusiek chebo tai ko moche kinet lagok how to do business because makomi ng'alekab kasi ko iye inam biashara sisir biik.
En komastanyin komwa Dr. Kipkoech Arap Sambu kole kabunchi kamanut rutoitab Dr. CK Joshua kosubkei ak nekaibwat icheket komiten en uindo ak nyigisindo.
Konyo my brother Dr. CK Joshua konyo ketoret ketul kisoi siret bo murtonyin ko kiboiboi mising yoche Kipkeles koit Ainop Keles inendet Keles akonyo koberurech ak kasit neo kobaten mbaka konyo kosoi siret bo murto ko kongoi mising Daktari CK.
Ambassador Lily Chelangat Sambu ko kikisiche en kenyitab 1954 ako somanen sukulisiek cheboto Alliance Girls, Moi Girls Eldoret ak sukulitab barak nebo Nairobi University. Kiito boisiet en ministry nebo somanet en emoni kotomo kotokyigei embassies en emotinwek cheterter cheboto emetab South Africa, Germany, Washington DC en United States, Namibia ak Canada. kobakach inendet werik aeng Kipkirui Arap Kitur ak Tirop Kitur. Kong'eten county nebo Kericho, logoiwekab emet chebo Kass, kainenyun ko Robert Siele.
Kaindochi President William Ruto lumdaetab ureriet nebo anan kabelisiet nebo 2025 WRC Safari Rally ole kalumda taunetabkei nebo kabelisionoto en gotab tuyosiek nebo KICC ole tesetai urerionoto kong'ete raini akoi betutab Jumapili eng Naivasha County nebo Nakuru. Kaboibochi Ruto en kasarta age boroindo nekanyoru emetab Kenya nebo kotet kabelisiet nito ole kamwa kole kikotestai Safari Rally konde tai emetab Kenya ng'alek chekarob eut rubeiwotab nebo kecheret en kibagengeit nebo FIA Rodrigo Rocha ak kora afisayat neo en benkit nebo KCB Paul Russo.
The WRC Safari Rally has been a key part of Kenya's sporting heritage and a pillar of our sports tourism. Hosting this event, the only FIA World Rally Championship leg in Africa, is a win-win partnership for Kenya, the continent, and FIA. I assure both the FIA and WRC that the government of Kenya remains committed to supporting this event now and in the future.
Is a testament to endurance, skill, and unwavering passion for motorsport that thrives across Africa. This legendary rally remains one of the ultimate tests for both drivers and machines, combining Kenya's breathtaking landscapes and the relentless challenges that the rugged terrain. This year, the participation of crews from 20 nations and 4 manufacturers underscores the global appeal and prestige of this event.
We are ready with all the routes and all the events from now, and I want to invite Kenyans to enjoy the spectacular moment of this rally, because it is not just a motorsport, but it is an inspiration of all our economic ecosystem.
On behalf of the sponsors, Your Excellency, I want to recognize Safaricom, Sifao, Kenya Airways, Betika, and yours truly, KCB, for stepping into the space to be able to make this event happen. An entity like KCB has spent 2 billion shillings since 2003 to keep rally going in this country. And this year, we are sponsoring 4 drivers. Your Excellency, the daughter mother that you took a photo with, actually sponsored by KCB.
Miondo nebo seriat nebo lung cancer ko agenge en mionwek che kotestai koim en kebeberta neo biik chechang chebo emoni amun neui kechigil Kenya. Kosubkei ak ng'omutik chebo mionoto en sipitalitab MTRH ko kergei kabarunoik chebo lung cancer ak chebo mionwek alak kou TB. Ako noto koui mising kenai kobate tindoi kamuget sipitalitab MTRH kochigil akonya mionoto ole nyolu en biikab emet kochigilgei asige nya mionoto. Genyorun Isaac Kogei ak report kong'eten Eldoret.
Seriat nebo buonik anan lung cancer ko agenge en kaimutik chetesetai koimi biikab emet mising ko en kasarta noton nemakechikil ak kinya en kasarta noton makat. Ako kong'ololi en kasarta nekakilumda tetutiet ne naat kou lung cancer care toolkit en taonitab Eldoret komwa kipng'omutinik cheboto Lawrence Atundo Murunga Multinational Cancer Program kobun sipitalitab Moi Teaching and Referral Hospital kole kaimutiet neo netinyegei ak mionotok ko naet en biik ak ortinwek chotok chebo chikilet.
The diagnosis of lung cancer is very meticulous and very expensive, and basically needs a high-end, facility to be able to get it diagnosed. We usually say this at our facility. We usually say this as a slogan: tissue is the issue, the rest is a rumor. So even if you meet a patient or a client at the community level coughing blood and having chest pain and having difficulty in breathing, you cannot diagnose that client to have lung cancer until you have tissue. Now, taking tissue for lung cancer is one of the biggest challenge. One, it cannot be done by anyone. It must be done by a specialist. The interventional radiologists are the key persons who are able to avail the tissue from the lungs. And this is a procedure that is done either through CT-guided biopsy or ultrasound-guided biopsy.
Kamwa ine kole sipitalishek chemengechen eng kokwotunwek konyolu kikoch tuguk chotok chekiboisie eng kanyoiset asikobit kotoret konai mionwogik chenomegei kora ak seriat noto nebo puonik.
Western Kenya cuts across North Rift, South Rift, Nyanza, Western Province. We only have 2 interventional radiologists. These 2 interventional radiologists are based at Moi Teaching and Referral Hospital. So getting that sample is the biggest challenge. And since you cannot be able to diagnose clinically by looking at the signs and symptoms and whatever the patient is presenting with, then lung cancer becomes a challenge to diagnose.
And this initiative includes or involves aspects around training healthcare professionals so that they may be able to attend to patients with lung cancer based on knowledge. Part of also the work that we've been doing is to do sensitization or awareness creation to the general community about lung cancer, because it's a condition that really is biting, and more specifically in this county, based on reports and estimated data that was reported sometimes in 2017, 2018 and thereabout. And so we've been, doing these initiatives jointly with support from the Ministry of Health through the government, Ministry of Health, and the county government.
Mwae ine kole eng kwenutab counties tugul 15 komite tai county noto nebo Uasin Gishu eng counties cheimuchi kochigil ak konyaa mionotok kosubkei ak sipitalitab boror noto nebo Moi Teaching and Referral Hospital.
Now, 15 counties include Uasin Gishu. Out of these 15 counties, the counties that has demonstrated a very high number of cases is Uasin Gishu County. Now, it's not that there's more lung cancer within Uasin Gishu County. It's just that Uasin Gishu County is proximal to the healthcare. For diagnosis purposes, for follow-up purposes, Uasin Gishu County is very proximal. So Uasin Gishu County is privileged to have the opportunity to have its population access care sooner, faster and better than many of the other counties.
Gideon Nayoda ak David Mushoki kobun non-communicable diseases korirtoe kora uindab sobet neityin makinya biik chotok chechang chekinyorchin mionotok.
Lung cancer is one of the chronic NCDs. The treatment and the management and even the palliative care journey is expensive. Patients are experiencing out of pocket expenditure that is quite high. Families are becoming or are getting into poverty and they are not able to manage. It's a call for us as a united force for the government to continue with the investment.
Akot kunotok kobun kanyoik cheboisie eng sipitalishek chebo sub-counties eng county noto nebo Uasin Gishu kokere kotako kaimut mising mionotok kosubkei ak kabarunoik chotok chenomegei ak mionwogik alak cheboto TB, asthma ak sukaruk.
Facilities in our counties zimekuwa still roofed with asbestos, which is one of the major risk factor of lung cancer.
The elephant in the room is diagnosing lung cancer. Most often, we are confused between, is this TB or is this lung cancer? The beauty is we can diagnose TB and from what we do on daily basis.
Kong'eteke taonitab Eldoret eng county nebo Uasin Gishu, logoiwekab emet chebo Kass, kainenyu ko Isaac Kogei.
Betusiek somok kong'ete koitu emoni ko kakoit let rutoito nebo laitoriat nebo emetab Netherlands King Willem Alexander ak osotiondenyin Queen Maxima. Agenge eng tuguk che kotokchi anan koityi kamanut neo King Willem Alexander komito emoni ko kasubetab ng'otutik koboto ribetab imandab kipkosobei mising ko kosubkei ak yautik chebo nametab biik eng kimnotet anan abductions chekokerita en serikalit nebo Kenya Kwanza in arawek chebo konegit. Genyorun Victor Korir ak report in goindo.
Kitoi rutoitanywan en emetab Kenya King William Alexander ak Queen Maxima en State House Nairobi ole kinyor tokset ne inegen kobun President William Ruto ak First Lady Rachel Ruto kotomo kiborchi kondit nebo barak missing nebo 21 gun salute kobun ofisiek chebo Kenya Defence Forces. En kasarta ne komiten emetab Kenya ko koyai tuiyosiek King William Alexander ak Queen Maxima koboto ofisiekab serikali che tononjin mornok che terter koboto kora tuyet nebo mung'aret ne kotuiyo chemung'arainik kobun emotinwekab Kenya ak Netherlands ne kotokyin gei kikimitilyandit nemie ak boisiet nebo kibagenge en kwenutab chemung'arainikab Kenya ak chebo Netherlands. En betut netetat kowektegei emenywan kokoyai rutoito King William Alexander ak Queen Maxima en ofisit nebo Chief Justice Martha Koome. Ole akot ngandan mang'alal ak sirikab logoiwek kowebata tuiyonotok komiten kamangunet kele kang'alal ichek akobo ribetab imandab kipkosobe koboto kasubetab ng'atutik en emetab Kenya kou en kurset nekokon en tai King William Alexander koityi President William Ruto koker kole koityi komonut magutik koboto imandab biikab emet en kasurek tugul missing ko en magutik ak imanda nebo neranikab emoni.
We believe in the future of Kenya, a future that will be determined by the Kenyan people. With a population whose average age is 20, your country is fortunate that it can rely on the ideas and energies of millions of young citizens. The people of Kenya, like those of the Netherlands, want their rights as free citizens to be respected and their voices to be heard. I'm pleased that our country's strong and mature relationship allows us to devote attention during this visit to issues like human rights, good governance, and accountability.
Victor Korir, Kass, Nairobi.